Hello, my name's Joanna and I'm a psychologist, and a few years ago I used to work in a respiratory service in the NHS for patients, adults with long-term heart and lung disease. So I did a lot of work with people experiencing unpleasant respiratory symptoms like breathlessness and persistent cough, and working with them to support them with the anxiety that obviously goes along with those kind of really unpleasant and scary symptoms. At the moment, with the coronavirus pandemic, a lot of people who've never had that kind of problem will be experiencing it, and I have a close family member who is seriously unwell at the moment, and the other day I was helping her through a particularly bad episode, and I thought perhaps it would be useful to make this video for anyone who is looking for ways to try and manage some of the symptoms at home. And what this isn't is any kind of medical advice. If you have new symptoms or a worsening of your symptoms, then obviously I've always said to anybody, seek the appropriate medical support and guidance. But this is for people who are working alone at home with managing the cough and the breathlessness. So there are 5 things that I'm going to suggest that you can try, and some of them are for when you are feeling a bit calmer and you're not coughing as much, and sometimes those are the best times to try and build up some resources, because when we're in a really difficult moment, it's hard to then draw on these things. So the more that we can practice them when we're feeling a little bit calmer, when the coughing has subsided, the breathlessness is calmer, the better. So the first thing that I want to say is that anxiety is a really natural response to feeling breathless and to having a persistent cough. We take our breathing for granted, and so when it suddenly becomes very obvious that we're struggling, that in itself generates even more anxiety. The problem with that is that anxiety itself causes us to become more breathless. And one of the ways that it does that is that we tense up. We tense this part of our chest and our shoulders get raised. And so I'm going to keep my shoulders raised like this, which is more than you might think that you would do when you're anxious. But I want to demonstrate that very quickly it's becoming hard for me to talk and to catch my breath. And if I kept like this, eventually then I just wouldn't be able to continue talking. So the first thing to do when you're starting to feel breathless is to make sure that you drop your shoulders as much as you can, you elongate the neck. Nice giraffe neck kind of position, image in your mind, that you want to open up this chest area and help yourself by lowering the shoulders, because even if they're raised just a little bit, if you're already breathless and already coughing, you're just making that a little bit worse. So drop your shoulders. The second thing is, if you can, is to try and lean forward. Maybe lean over a chair or onto the back of a chair, or even if you just are standing, leaning forward ever so slightly. You don't want to get off balance, but you just want your body to be tilted more forwards than backwards. And you'll probably find that that naturally happens anyway, because the body just responds to the symptoms that it's having. The third tip is to focus when you can on controlling your breath. And one of the things that we can do when we're breathless and when we're coughing is use that as a trigger to think, now is the time to really focus on each individual breath. Because remember, I am breathing. I might be breathless, I might be in pain, I might think all sorts of really scary thoughts, but actually, they're all signs, I am breathing. So saying in your head, I am breathing, I am breathing, can be really helpful. The fourth thing is, when you feel that your symptoms are not quite as bad, maybe when you're resting, is to try and do some controlled and slow breathing, because that helps to reset and lower some of your anxiety that will already be just generally heightened. And it will make it easier when you are then having a breathless episode to try and use this skill if you've already practiced it. And so the focus on this is that however long you breathe in for, you count the in-breath, you then pause for the count of 2 or 3, and then you breathe out for double the time. So if you can breathe in for 2, 1, 2, hold for 2, 2, breathe out for 4, 1, 2, 3, 4. Breathe in for 2, hold for 2, out 2, 3, 4. And if you can do that for 3 and 6 or 4 and 8, the more the better. It's not a competition, and it's not if you could breathe for 4 and 8 yesterday and today you can only breathe for 2 and 4 today. You know, that's the kind of thinking that we can suddenly get into, comparing ourselves and our symptoms. We're not doing that. We're going to set that aside. It's natural, it's what the mind does, it tries to make sense, but it's panicking to make sense. It's comparing. We're just going to focus on that breath, and in that moment you're just counting every time. In, 1, 2, 3, hold, 1, 2, 3, out, 1, 2, 3, 4, 5, 6. And as you breathe out, you're going to purse your lips and imagine that you have a spoon with soup on it. And you don't want to blow the soup everywhere, but you need to also reach the spoon. So you're going to control and blow very gently onto your imaginary spoon of soup. And then if you can, at the end of that, you'll try and take a little pause before the next in-breath. Because what happens when we're anxious is that we start to try and breathe in more and more and more and get more and more oxygen in. And actually, unless we're able to breathe out and empty the lungs, we can't get more oxygen in. So it's that out breath and elongating that out breath that lowers the anxiety and also helps regulate the lungs and their function. The last point is around movement. And when people are used to just getting up and moving and doing things, when you become breathless every time you move, that is also very anxiety provoking. I don't need to tell you that if you're experiencing it. It's very obvious. And what it does is it causes people to, one, not really want to move, which is understandable. But that in itself, in the short term works, but in the long term just causes you to become more breathless when you do have to move. And also, if you're alone or, if you're self-isolating at home and you still, have to get up and get a drink and go to the loo and all the normal things that you need to do, you are going to have to move. So the best way to do that is to do it very deliberately and slowly. So anytime you move, if you go from lying down, you sit up, you take a couple of breaths like we just did, and then you stand up. And when you stand up, it's best if you've got something you can hold on to, just to steady yourself for a moment. Take a couple more breaths, and then when you're ready, you start to move. And you take a step, take 3 steps, whatever's comfortable. Although you're breathless, you may feel a little bit dizzy and lightheaded, in which case you stop and you just wait. And you know that this will pass, and you're just going to take your time and take it a step at a time. The other thing that can happen is that you can get a lot of pain when you're moving and coughing, because the muscles around the lungs are stretched and in pain. And so movement that helps to kind of keep the muscles in action is actually helpful. So it's a real balancing act, and it's very hard, and this is where it's difficult because I can't tailor this to anybody, and you have to find your own balance between resting and allowing your body to do what it needs to do, but also when you do need to move, if you are in pain, knowing that it's quite natural for that to happen. Of course, if you have new or different kind of chest pain, again, you seek medical support, but don't be surprised by pain. Pain is a natural part of being breathless and persistent cough. I hope that some of these suggestions can be helpful to you. This is a really scary and difficult time for everybody, and for those who are self-isolating alone, my heart goes out to you, because I think to be with these horrible symptoms and alone is a really terrible, terrible situation to be in, and I wish you every strength to get through it and to come out the other side, and to know that there are people who are really rising to the challenge of supporting each other. And whether this video is helpful or other resources are available to you, I wish you every support that you need at this time, and all the best for the future. Thank you for listening.